development and population growth on public safety, as well as highlighting other issues, resources, and opportunities for action related to health. Before we start, a couple housekeeping things. For those on Zoom, we ask that during the presentations, you stay on mute and put your comments and questions in the chat. For those who are here in person, please mute your phones, and we have index cards for questions that we will be collecting as we go through the day. Following the presentations, we will have opportunities for participant comments and questions. A little bit about the League. Since 1920, the League has worked to empower voters and defend democracy as a nonpartisan organization. We promote political responsibility through informed and active participation in government, and we take action on selected governmental issues. The League of Women Voters does not support or oppose candidates or political parties. We do voter registration and encourage engagement for all citizens, and we also encourage returning citizens to get their rights, help them to get their rights restored, and we are doing outreach to youth. We do educational events to increase understanding of public policy issues and to engage citizens in the decisions that impact their lives. We influence public policy on League positions developed after extensive study and member agreement. And all of these publications are available in a publication, and also all of our positions are available in a publication, Impact on Issues, as well as online on the various websites. Later today, after this event, we will be having a second event related to mid-cycle redistricting, and all of you are invited to attend that, which will start at 11:15. The League of Women Voters policy on healthcare is to promote a healthcare system for the United States that provides affordable access to a basic level of quality care for all U.S. residents. And this includes behavioral health, that is integrated with and achieves parity with the physical health care system. Basic care for the League includes disease prevention, primary care, including prenatal and reproductive health, acute and long-term care, behavioral health services, oral health, and also the promotion and education on healthcare issues. The League believes in the right of privacy of the individual to make reproductive choices, and we have lobbied for healthcare policy solutions, including the Affordable Care Act, and we are working in favor of Medicaid expansion because those are the ways that people can have healthcare services available to them at a reasonable cost in the United States. At this time, it is my honor to introduce and turn the program over to our moderator, Lorna Washington, who I'm sure many of you know. She is a League director. She's an advocate, communicator, business owner, entrepreneur, and wearer of many hats. She didn't give me a bio, so I just made it, but it's all true. You all know her. So with that, I'd like to introduce Lorna.
Good morning, everyone. That was the perfect bio. Sandy's known me for quite a number of years. As a matter of fact, the reason why I'm part of the League is because of Sandy and Judy. I met them it was an MLK event years back, and they recruited me to be a part of the League. So I thank their advocacy and what they do in the community. And I say, hey, I'd like to be a part of this organization. So I've been a part of the League. I believe it started back in 2012. I was just like many people, came to the meetings, listened to the topics, and then they recruited me to be on the board. So, well, it's going to be almost 2 years. I'm serving my 2-year term. And the reason why I selected health is many of us are affected by health in some way, shape, or form. But a few years ago, I started advocating for mental health. Mental health is, especially after COVID and the hurricanes and the storms, and even in our community, many of us have lived through the upturns and the downturns of real estate, the crashes, the recession, and it's affected many of us on so many levels. But even recently, I approached one of our county commissioners and I say, why do you keep approving all these developments? Because I feel personally that our community has not been able to keep up with this growth. And we can go on and on about so many ways that we cannot keep up with the growth. But during researching about mental health, I find out the lack of services available to just our residents and even the visitors that come here when it comes to mental health. And then when we dig deeper, just basic health. I remember when I moved here 25 years ago, I can call my doctor and get in there in a day or two. How many even now when you call, it might be 3 or 4 months. Long time, yes. So I am so happy that we have a great speaker today. She is a retired nurse. This is Susie Allen, and she's a retired registered nurse with 43 years of experience in pediatric critical care, neonatal ICU, emergency medicine, oncology, hospice, and nursing education. Ooh, some really good areas. After relocating from Virginia to Alva, she was dedicated her time and expertise to community advocacy, preservation, and civic engagement. She currently serves on the board of trustees of the Alva Museum and is a founding member of Alva Strong. Presently serve on the board of Alva Inc. Susie is also an active member of the Lee County Republican Executive Committee, where she serves as membership chair and is chair of the Ethical Campaign and Accountability Initiative. Her advocacy focuses on preserving rural and conservative lands in Lee County with a strong emphasis on public safety amidst the region's rapid population growth. Through her research, Susie has highlighted how unbridled development worsens the strain in Lee County already medically underserved healthcare system. Educating and informing the public and the board of the county commission on these issues remains a central part of her mission. Beyond her civic and professional contribution, she's a semi-professional potter, a wife, and a benevolent dedicator of 2 dedicated dash hounds, one questionable, a dash hound, say that again. Dachshunds, one a questionable generic, and 2 German Shepherd grand dogs. So let's welcome, we are honored today to have an awesome guest in the midst of us. Let's welcome Susie Allen to speak about our healthcare in Lee County.
You know, it took me nearly 70 years to have to come up with a bio. It's just, I still don't really understand it. But anyway, as you can see, we are falling short in healthcare, and we're between a rock and a rock. I noticed when she did the bio here, that some people were nodding when she said how long it took to get a primary care, get a doctor's appointment. So I want to shout out how many, just shout out how long it took you to get a doctor's appointment. Anybody? 2 months? Anybody to wait 2 months, 3 months? There's 4 months, 3, 4. Yeah, it's that not just the stupidest thing ever. I just don't get it. Next slide. So I want to tell you a little bit about myself that did not get covered. Now, this is the dashboard of my car. I am from Virginia, Northern Virginia. I was born in Washington, D.C. I was a nurse for 43 years, like she said. And I moved here from Virginia about almost 6 years ago. So how many of you are native Floridians? Like 3, 4. Okay. So you 4 know that if you come here to visit, you're a Yankee. Like I'm a Yankee, right? But if you come here to stay, you're a damn Yankee. Okay, so I am a damn Yankee. And for those of you, here I'm going to talk about population growth and what it's doing to our healthcare system, but I'm partly responsible for that because I did move here. But when this was about a week before I retired, and I want you to notice a couple of things here. This one right here. This is why I said when I retire, I will never let an alarm clock wake me up again, ever. This one right here, self-explanatory. Seriously. So that's what nursing is about, waking up early and having to put up with really low weather when you're in the north. So I moved down here, and right after I moved here, I got this rumor. I live on about 2 acres, and I live on this great street with these great people. I mean, everybody looks after each other. We all love our kind of rural lifestyle. There's cows. It's similar to where I moved in Virginia. I kept moving out from the city, and we lived on a hobby farm. We had alpacas and goats and stuff. And so I kind of moved to a similar area. Next thing you know, I hear that they're going to put over 1,000 houses behind us. Now, we had a community plan that said 1 house on 1 acre, and they want to put houses that are like 30 feet across and have no front door because there was no room for it. So anyway, that's my backstory. I started one of about 5 or 6 people that started a group called Alva Strong, where we decided we've got to do something about this. And, you know, we've got tortoises and things we really care about, we want to preserve. And so next slide. We started this group to fight it. Now, when you talk about population in healthcare, I want you to think of a big guy, and he's a Floridian, he's addicted to key lime pies. And he orders key lime pies from Whole Foods all day long. All day long, he's just got bag after bag of key lime pies coming. And his answer to the question is, I just need a bigger stomach. Okay, not cut down on the key lime pies. I just need a bigger stomach. Well, that's what we're doing here in Lee County. It's like one of the commissioners said, well, we have to put these people somewhere. So we keep feeding the county houses and people in development, and we keep pushing and pushing the demand side. But when it comes to healthcare, doctors, nurses, hospital beds, emergency response, we're way behind. So it's like, you can't just say we need more doctors, we need more nurses. So at some point, the powers to be have to say, well, wait a minute, we have to look at the demand and the supply side. So unbridled growth, we see this in our county. Our commissioners seem to be hell-bent on just approving everything. So that's one of the spots we need to really focus on is reasonable growth, smart growth, making sure we have for infrastructure and things before we put people in. Conflict of interest, you see this on our board. I'm not saying they're doing anything wrong. I'm saying there's an appearance of impropriety. That's all. There is an appearance of impropriety. When you have somebody on the board of commissioners that owns property that he benefited from by getting the water and sewer, and he didn't recuse himself in the decision. We also have an aging population, and the population here is the mean is like 50, and nurses are aging. Our population is aging, and that's meaning that, you know, you need more time when you go to the doctor. We have a primary care shortage, which I'm going to get into, nursing shortage and delays in the EMS response time. So those are the kind of the 3 areas I'm going to focus on. And I was going to try to make this entertaining, but to be honest with you, it's more terrifying than entertaining. So next slide. So again, we have to look at what's going on population wise. So Lee County, let's look at the United States. The average number of, this is population per square mile in the country is 93. In Florida, it's 393. Lee County, 963. Okay, we are a highly populated. Now, we're not Miami yet, but we're working on it. Okay, we're working on it. Okay, next slide. This poor guy, he says, your case is quite advanced. It's better to catch these things early, because when I got here, it was early. So Lee, and that's kind of how it is, guy. Lee County is one of the 10th fastest growing counties in the nation, with an estimated net increase of 23,000 new residents in 2021. More than 8,200 of those new residents moved to Cape Coral, and nearly 5,900 were immigrated to Fort Myers, placing both at the top of the list of nation's fastest growing cities. With this population expansion comes the need for more services to meet the growing needs of our new residents, particularly medical services. This comes from Lee Health. Okay, next slide. Okay. When you talk about medicine and population, you have to look at what is the definition of medically underserved, and Lee County is considered medically underserved. And it's based on the primary care physicians. And that includes nurse practitioners, PAs, things like that. But primary care, we have a primary care doctor shortage, which anybody who tried to get an appointment with their primary care doctor knows that. I want to tell a story about 2 of my friends. my roommate in nursing school, her name is Kay. We've been best friends since I was 17 years old when I was in nursing school. And about 3 or 4 years ago, after the COVID vaccine, she had a reaction, ended up getting into carditis. She already was obese, had diabetes, kidney failure, the works. So she ended up in the ICU for about a week, had to be put on dialysis, multi-organ failure, heart failure. She had a 95-year-old mother, and so I moved them down here. As soon as she got out of the hospital, moved them down here. You're going to need help. So she moved down here, and about a year later, she was diagnosed with cancer as if she didn't have enough problems. So the doctor, they went in, they did hysterectomy, said, okay, you're good, caught it early, you should have no problems. But I need you to follow up with an oncologist. How many months did it take her to see the oncologist? 4 months. She ended up having to go to Tampa. When she went to the oncologist, the first visit was okay. The second visit, she had cancer again, and she is now on hospice at home. Her mom passed away about a year ago. But how can that be in a country such as ours, where you have to wait that long to get a specialist for something? I mean, her original prognosis was like 3 to 8 months. It took her 4 months to get an appointment. It makes no sense. Another story, I have a friend named Curie. About 2 months ago, she had diverticular, which is a little bleb in the intestine, and it ruptured. So she had a ruptured gut. Bad news, not good. You don't want a ruptured gut. And so she went to the hospital, got her antibiotics, got all fixed up. They said, follow up with a GI doctor. How long did it take her to get a GI doctor? This was in early August. She can't see a doctor till February. She had a ruptured gut. Come on. I mean, it's just crazy. So we are medically underserved. Now, you will also hear the term medically underserved population, and that is like the elderly, people in poverty, those subgroups, and you'll have those spattered everywhere. But as far as the area of Lee County, we are medically underserved because we don't have enough primary care doctors. Next slide. Again, when you look at medically underserved populations, too few doctors, high infant mortality rate, high poverty, high elderly population, which we definitely have here. Administration designates nearly all of Southwest Florida is considered medically underserved. And then on top of this, you have to remember how seasonal people. There's one hospital group, they normally have like 500 nurses at a time. They have to go up to 700 during season. So where are they going to get these nurses from that aren't working all the time? They're going to get travelers, which is ridiculously expensive for hospital to pay for travelers. Now, I think some of the traveling nurses I've worked with have been excellent, but they're not all excellent because they have to get used to your system every time. They're also pumping in new grads over the summer. So you're going to get an influx of new grads and also new residents if you're at a teaching hospital. And the last thing you ever wanted to do is be the nurse that was working the first day that the residents got out of medical school. Bad. Okay, next slide. Okay, so 2 things happen when you're dealing with lack of primary care doctors. When you have more primary care doctors, it lowers the cost of healthcare by 33%, and you have 19% lower odds of dying early. Now, I want to make a little caveat to this. When I was younger, nursing was very different. Medicine was very different. You went to the doctor for your annual physical, and you stripped naked, and you sat on the cold table with a little piece that's this big. And they felt your belly, they looked in your eyeballs, they looked in your ears, they looked in your throat, all around, right? Looked at your skin. When's the last time you had anybody do that for you? Never, never. You just don't see anymore. I go to a nurse practitioner, I think she's great, but she doesn't do an exam. And how many times have they done this with the? They're doing nothing. Call them on it. Going, you did not listen to my breath sounds. Call them on it. because they don't listen. They're supposed to listen all the way in and all the way out in several places. When they listen to your heart, they should be going 3 or 4 places and listening. When I had student nurses that I had to help train, the first thing I told them, don't look at the monitor. The monitor will lie to you. The patient never lies to you. Are they pink? Are they breathing? You know, are they blue? These are important things. Doctors don't do exams anymore. Went to took my husband for a primary care visit just a couple weeks ago. And the guy even admitted, well, I just have to check the boxes on Medicare. Answer the questions. They sit there with the computer. They look at the computer. They don't look at the patient anymore. So one of the things the primary care doctors have had to do, because there's not enough of them, they cut their visits to 8 to 12 minutes. It used to be you had 20, 30 minutes with your doctor. That hadn't happened in a long time. And the thing is I used to do, toward the end of my career, I have bad hips and bad knees from being on my feet for years. I did these pre-surgical interviews. If you're a nurse, never, ever do pre-surgical interviews. It sounds easy. Worst job I ever had. Worst job ever. You can't get an answer from people to save your soul. Do you wear glasses? Yes or no? That's all I need to know. I don't need to know about your aunt and your eye problems. Okay, so anyway, so they've cut these things to 8 to 12 minutes. You don't even get through a med list of an elderly person in 8 minutes. You don't. I mean, it's just, so it's crazy. So basically what I'm telling you is it's crazy. Okay, next slide. This was a quote from Week News. There are not enough primary care doctors go around, and that's just one piece of the puzzle for why all Southwest Florida is considerably medically underserved. Florida is projected to have the second largest physician shortage in the country by 2030. Thank you, commissioners. Okay, so let's talk a little bit about the actual physician shortage. 30% of the primary care doctors are over 60. That means they're going to be retiring and playing golf. 30% of the population is over 65 with a median of 50. So you're talking about older doctors about to retire and people who need them the most. Demand will increase to 2 to 1 by 2036. We have the 4th most populous state in the nation. Florida faces a severe physician shortage, particularly in primary care specialties, in rural areas, and in number of doctors to care for the state's rapidly expanding population of older patients. This is especially true in Southwest Florida. So if you look at the demographics here, I'm sorry, this is a very heavy statistics talk. Average is 76 primary care doctors for 100,000 with the benchmark of 100. So nationally we're under, and then there are about 70 per 100,000 in the US. And in Florida, Lee County is between 50 and 75. I'll be honest with you, I couldn't find the exact statistic, but that's the range I'm told I finally figured out doing some math. 30% among these states, 30th among the states. So of 50 states, we're number 30 in how many primary care doctors. And yet we have the highest population of elderly. And again, you put on top of that seasonal visitors. Yeah. The highest deficit is in Cape Coral, Lehigh, Alva, and Fort Myers. And we're about 880,000 people in the county. Will be 1 million by 2035, especially at the present rate. So let's talk about something near and dear to me. We have obviously have a nurse shortage. A lot of nurses dropped out after COVID. It was just horrible. I actually was very blessed. I retired January of 2020 and was like, thank you. I was on my knees every night. Thank you, thank you. But my friends weren't so lucky. That was back when, you know, with the mask things, before the controversy happened. I made 350 masks in my home and went to all the restaurants I like, because that's the most important place you have to be. All the restaurants, and passed out the masks because I said, you guys got to stay open. Seriously. So the reason why do nurses leave nursing? You think it's underpaid? No, actually, I was paid very well as a nurse. I had a 6-digit income when I left nursing. That's pretty good. I liked it. I thought it was great until I lost it. But we leave nursing because it's unsafe. You go in and you get, now it's not unusual for a staff nurse on the floor to have 8 patients. That's crazy. You would be pushed in the ICU to take 3 or 4 patients. It should be 1 or 2 patients in the ICU. This is a problem across the nation, but I'm sure that it's the same issue here because we're way short. So where are you going to fill these nurses up? You're going to get them out of nursing, you don't get them out of the universities. And I got to tell you, I graduated from what we call a nursing school. They don't have them anymore, which I think is unfortunate. We went the same number of months as a BSN program, as a bachelor's program. We had a liberal arts education, we had English, psychology, sociology, all of our major sciences, anatomy and physiology. We're all done in university, but you had all your nursing done at a hospital with real patients, and you had to actually take care of patients. So I'm not impressed with the college nurses coming out. Do not know what to do. Nothing more dangerous on the planet. Not a rhinoceros, not a hungry lioness. Nothing is more dangerous than a new nurse. Nothing. I know because I was one, and I think back, God, I never had a sentinel event in my career. Thank you, thank you, thank you. How it didn't happen, I don't know. Nurses are pushed to the limit. There was a nurse, and people can criticize her. Oh, she made a horrible patient died. She pulled, there were 2 meds. One's called Vecuronium, one's called Versed. The stupid hospital put them side by side in what we call the Pixis, the med drawers. She's super busy. She got more patients she could take care of. The radiology department calls her, said, I got a patient in CT. They're freaking out. We need to give them some Versed. She's all hairy. She's overwhelmed. She goes, grabs the medicine out of the thing, runs over to radiology and gives the patient Vecuronium. Vecuronium is a neuromuscular paralyzer. Patient couldn't breathe, was in the scanner, nobody watching him, died. Now, is it the nurse's fault? In part, absolutely. She didn't look, she wasn't careful. She was rushed. 2 times a nurse is going to make a mistake, when they're rushed or when they're bored. That never happens anymore. So, you've got systemic problems because you're understaffed, and then people feel afraid, and they have to do something quickly, and they make mistakes. Okay, this slide's a little crazy. This is just talking about the ratios of supply and demand. Again, you can't ignore demand. If you keep ordering the key lime pies, you're going to have problems. So we have here, this is the supply. This is how many people we're expecting we're going to need. We're going to need another basically 5,000 full-time people. And then the demand is 5,000 full-time people. So we're just behind the 8 ball. The other problem with nursing is violence toward nursing has rapidly increased. I don't know what's going on with our population, but they think that if they're upset about something, they'll hit a nurse in the head. There was a nurse beaten up by one of her patients, lost an eye. She almost died. So this is becoming a more common occurrence, and nurses are really under threat. All right, more than a quarter of our nurses plan to leave in the next 5 years. 26% are older than 60 with the aging population and sicker patients. When you have too few nurses, infection rates go up, medication errors occur, increased wait times, higher mortality rate. It's not McDonald's, okay? You can't just expect, when a nurse makes a mistake, it's not you didn't get pickles on your sandwich. It's somebody dies. Next. So this slide shows that the population of nurses in the states. So we're at the lowest level, less than 10 per 1,000 here. And I don't know what's going on up here in the purple states. You know why? Because they don't have any population. Yeah. It's easy. It's an easy one to figure out. Okay. Critical nursing and physician shortage, not an inconvenience. Southwest Florida is one of the fastest growing regions in the state. Collier and Lee counties have seen an increase in population of nearly 20% to almost 28% since the 2010 census. Population growth, according to the Office of Economics and Demographics Research for the state of Florida, estimates that Collier and Lee County will grow by 253,000 people by 2035. That'll put us about at 1 million. Over 30% of the population is over 65. These are the people who need health care the most. The percentage of this demographic is also growing. Population growth is one of the greatest forces to change in healthcare and threatens the ability to provide access to care for the people in the communities. Healthcare shortages are not just an inconvenience, it's life-threatening. Okay, so we're going to talk about emergency services now. And I'm kind of break it down to the three big ones: trauma, heart attacks, and stroke, because those are really the three that are really time sensitive. Okay, so next slide. There's a thing called the golden hour. If you ever worked emergency, I worked emergency for a while, worked actually pediatric emergency is a little different than adult, but we did do traumas. And there's a thing called the golden hour. And it's a period of time immediately after a traumatic injury during which you have the highest likelihood that with prompt medical care, you'll live. Okay. So that time, I hate to tell this story because it's a horribly depressing story, but we had a child brought in. She came in this frilly little dress. Oh, God. And they came in and they wrote in the triage, vaginal bleeding. And the child was asleep in their arms. So we brought her right back, said, vaginal bleeding, it's a 5-year-old, what's going on? So couldn't rouse her. Family was not English speaking, trying to figure out what's going on. And we remove her clothes and there's a tire track across her back. It had happened 4 hours early. They didn't come in. They wrote down vaginal bleeding. Kid died. And it was like, we could have probably have saved that child if they'd gotten right in. They waited 4 hours, gave her a bath, put on the frilly dress, and finally decided, well, maybe we better take her to the ER. Very depressing story. Sorry to join. The other really disturbing thing about trauma in Lee County specifically is that our sheriff department has 9 traffic officers, 9 for all of Lee County, 24/7, 365 days a year. Do you want to know why you don't get a speeding ticket? I haven't gotten a speeding ticket since I've been here. I will testify that there are no traffic cops out there because I would have gotten a speeding ticket if there were traffic cops. You see the empty cop cars everywhere? Yeah, they don't fool me anymore. No, they're not fooling me. So when you have a situation where you know you're never going to get a speeding ticket, you go out here in 75. And for those of you from Florida, I apologize for this comment. I call them Floridians. I apologize. It's not nice. So we had 125 fatalities last year in Lee County and over 9,000 injuries. It's crazy. I mean, why don't we have more people, at least getting the crazies off the road? Okay, next slide is time is brain. We're going to talk about strokes. From the onset of a symptom, so you have your face drooping, your slurred speech, arm weak, get your butt into the ER. Don't wait. Kate, we talked about Kate when her mother was still alive. She had a problem one morning just picking up a Coke can. She goes, something's wrong with my hand. And Kate's like, oh, she has that carpal tunnel. It's that. I'm like, no, it's not. It's not. She was an L&D nurse, so she didn't know. She wasn't in labor. So I'm like, no, something's going on. And she had a stroke. She had a little teeny stroke. I was right. It was subtle, but you need to get in because we have about a 90 minute window from the onset of symptoms to getting them revascularized to save brain. So time is brain. So it's super important to get patients to the hospital when they're having signs of stroke. And this statistic I thought was kind of almost funny. Typical patient loses 1.9 million neurons every minute when a stroke is not treated. Now, I have people that don't have enough neurons to begin with. I don't have enough neurons to begin with. I cannot sacrifice 1.9 million neurons because I was stupid and didn't get to the hospital. But here's the problem. How are you going to get to the hospital when you have so darn many people on the road and the ambulance can't get to you? They don't have enough traffic cops to clear the way for you. They don't have enough EMS services to get to you. Okay, next thing is time is heart muscle. There's a type of heart attack called the widowmaker. You've probably all heard of. It's called a ST elevation MI, technical terms. It's called the widowmaker. You have 90 minutes from the first contact to what they call the needle to revascularize that heart. Symptoms to door time is average about 3.5 hours because people, again, don't recognize it. And then you have the delay in getting to you, and then you've lost your life because it took too long. Okay, this is where you get to the scary part. Next slide. Okay, the benchmark. This is the average time. This is what all the EMS services are shooting for. They want to get you in 8 minutes and 59 seconds, 90% of the time. That's where they're shooting for. I spoke with one of the EMS captains, and I said, how are you guys doing on your response time? He goes, well, first off, he says, I was the only group that ever even met a response time. He said, we're way under. He said, we're way, way under. Now, I'm not saying the EMTs are not doing they're doing a great job, but they're working under a horrific situation. This is probably the scariest slide I show. The line is the benchmark. We want to be above that line. The red are critical patients, life-threatening instances. These are your strokes, your heart attacks, your traumas. These are the people who had paper cuts. Okay, I don't laugh at that. I had that. I had a patient come in by ambulance in the ER with a paper cut with her boyfriend. She followed the ambulance in the car. I'm like, honey, why did you call the ambulance for a paper cut? She goes, well, every time I look at it, I feel faint. I was like, sweetheart, don't look at it. Put a Band-Aid on it. I said, I'll get you a Band-Aid. I couldn't find it. She came in by ambulance. So anyway, that's one of the problems. We have people calling ambulance that don't need ambulances. But look at this. This is horrific. This could be your child that fell out of a tree. This could be your husband that's having a heart attack. These are real people that are important to other real people. And we just put it on a graph and go, it's what it is. And that's what it is in Lee County. Okay. Why are emergency times important? The American Heart Association states that every minute the CPR or defibrillation is withheld, the chance of survival, decreases by 7 to 10%. Response times under 4 to 6 minutes drastically increase survival rates when CPR and defibrillation is not available. I was so concerned when I saw this statistic. I went out and bought a defibrillator for my home, and I suggest everybody do that. The new ones are like $1,000, and I'm like, I love my husband, I do. It's not worth $1,000. But $450, I was okay with that. I was okay with that. I got a used one, but he's used too. So yeah, I recommend you go on Marketplace and find yourself a defibrillator. And I did. I bought a defibrillator. It's in my home, and it's perfectly good. You know, you check it, make sure it's ticking, and so is my husband. But it's, this is serious. Remember, the benchmark is 8 and basically 9 minutes, right? 90% of the time. 4 to 6 minutes, you're in trouble. That's why you need one of these. And there are times, the same guy who was, he's an EMS chief or something. He said that, like where I am, when an ambulance comes out, it takes about 20 minutes to get to people. He said, but we're the only one. So when we're out at a call, the next furthest person is 25 minutes. You're never going to meet the benchmark. It's 9 minutes, but 4 to 6 minutes is going to save your life. Okay. I'm almost done. Okay, this was an arbitrary slide. How many of you waited a ridiculous amount of time in an ER waiting species? Or know somebody? Yeah. Well, when Kay got down here, we were frequent visitors to the ER. One time it took 8 hours to see a doctor, 12 hours to actually get treatment. I pulled this up. This is not an average. Okay, don't think this is an average. This was done at about 3 p.m. on a Tuesday. I just arbitrarily picked a time. Let's see what the ER wait times. So this is arbitrary during the day. Schools aren't probably not even out yet. And those were your wait times. That's ridiculous. I mean, even that's bad. But good luck in the ERs because you're going to be waiting a long time. And if you've ever gone to Gulf Coast Hospital ER waiting, you might as well bring a parka and a space heater. That's the coldest room I've ever been in my life. It's like, okay, people with fevers, let's put them in a refrigerator. Okay, the next and last slide is evacuation routes. It only takes about 41 hours to get out of here, guys, because of the traffic. So what have we learned today? We need to look at supply, demand, as well as supply. We need to cut the number of key lime pies we're feeding this guy. And how do we do that? Well, we need to influence our Board of County Commissioners to do that. We need to organize. We need to have our voices heard. And we need to make sure that when we vote the primaries and we vote for somebody who believes in smart growth. Because it is not just an issue of, I don't want people in houses behind me. It's not even just an issue as I don't want to see the gopher tortoises killed. It's an issue of my husband may not make it to the ER in time if he has a heart attack. It's an issue of I had to buy an AED to make sure that I would treat him because I know that our county can't get here in time. Not that they're bad nurses, doctors, and EMS, not at all. Those guys are heroes. But because we have not given them the tools to do their job, we haven't given nurses enough staff that they feel safe to go and work a day's work without feeling that I might kill somebody today. I worked at a church for a brief period, and I was terrible admin, absolutely horrible. But the pastor called me, said, I really need help. I was going through a divorce, need some, some project. So became an admin. And I did the wrong date on an event. And you would have thought, oh my gosh. I mean, they were just apoplectic. And I looked at them and I said, no one died today. No one died. Nobody's in the ICU. Nobody died today. I said, we'll just reprint them and send them out. And they're like, oh, okay, yeah. I said, in my job, when you screw up, you kill somebody. So help the nurses out, help the doctors out. Let's speak with our public officials to have smart growth, to abide by community guidelines, community plans. Don't alter them so that your own property benefits. And I thank you today for putting up with me. And that's it. I'm done.
Woo, awesome. So right now we're going to take a few questions. We have, I'm going to put one came from the Zoom and then we'll have some from the floor. So Zoom question for you, Susan. How does Lee Health going private help these issues?
I can't even speak to that. I like a nonprofit hospital. I prefer to work in a nonprofit hospital. I have not looked into that issue well enough to speak on it. I don't want to make it up.
Okay. Next, any floor questions?
Yeah. Yes, amen. Yeah. Yeah, high density housing is a scam. This is just my personal opinion. It's a scam because say the property behind us, you've got this massive 1,100 acres. Now, I don't know the exact statistics, but say 30–40% of it is swamp, high flood area. So they can't build on that anyway. And they know that when they bought the property. But in our plan said 1 house on 1 acre. So they want 1,100 houses because they bought 1,100 acres. right? Well, 30–40% of your property isn't buildable. So they want to cram all those houses into the small areas. They want credit for it. Okay. Yeah. Oh, existing. Uh-huh. Uh-huh. And less land, yes. And that, and yes, the high density thing, again, you are feeding the fat boy. You're feeding the guy the pie. All you're doing is you're still adding more people, and it's the people that are driving the demand side up. So we don't need more people. We need less people or level out until we can catch up with it. So high density, they kind of use it as, oh, it preserves land and all this stuff. We don't need more people. We need less people, or at least keep a stable population so we can catch up with all the infrastructure, including healthcare.
Okay, here's one question. How does the cost of living affect doctor shortages and nurses?
Well, I can't speak specifically to cost of living, but I will tell you that a lot of doctors come to Florida, med students and residents come to Florida. I guess they think we're fun, and they stay here for their training, and then they go back to their home states. So we're not retaining doctors here. And some of it, you know, cost of living is way higher in like New York and DC and places. So I don't know specifically how that's.
I recently read an article on that. It
Yeah.
says that the reason why we can't attract and retain doctors here is the average home in Naples, 900,000.
Yeah,
And
I'm
they can't
sure.
afford that. And then in Lee County, it was 500,000. So doctors don't see that. They're not making that kind of money.
So primary care doctors are the lowest paid. Pediatrician primary care doctors are the lowest paid, and
So-
OBGYNs
Yeah,
also.
so that's
there
what they
you're-
were talking about, the shortages, why we can't attract and retain, because the average cost of housing is so
Yeah.
high for, you know, a new doctor.
Yeah.
Yeah, and now someone says, how does the reimbursement rate affect patient care time?
How does it what?
Reimbursement rate affect the patient care time? Reimbursement, you were saying that the doctors spend just a few.
Yeah, that is also dramatically affected how many people want to go, how many doctors want to go into primary care. Doctors do not want to go into primary care, family medicine, or internal medicine anymore. It's the lowest paid. They had to cut, in order for them to make it the same amount of money, they had to cut their patient time to 8 to 12 minutes. That's where that comes in.
Okay. And then one more question says, what are we doing to change all these shortages? Doctors, nurses?
Okay, yeah, there are some programs. They've started a couple of programs. One is with the med schools to try to retain, and they have made some progress in the nursing as well. They have improved the nursing statistics down here, but it's still way behind the national average. And again, with primary care doctors, we still don't have enough, but it is getting a little better. But again, we keep feeding population into it.
I'm going to read this. Maybe you can. I cannot answer. The Florida legislature passed SB 160, which preempts local planning. So if all planning for growth and how we do it on a state level, how can this best influence this? SB 160.
I can't see and I can't hear anymore. I should have just asked. SB language. Local planning. Other influences. Well, I think everything starts locally. If we can flood our commissioners with what we need and want, not that it's necessarily going to be heard right now, but you have to realize too, in Lee County, we're 2-1 Republican. So we have to vote the primary, and we're a closed primary county. And if you need to vote, whoever wins the primary wins the election, is what I'm trying to say. So you have to make sure you're voting in the primary and voting for the right person. When I came down here, I went to the GOP office because I'm a Republican. Sorry about that. I went to GOP office. I said, I've never lived down here. I don't know who's running. I want to know who I'm going to vote for. And she went through the list and she said, well, I can't tell you one over the other. She got to my commissioner. She goes, well, they're a little pro-development. That's like, okay, well, I vote for whatever. Voted for him. It's like, what a mistake. Was the guys in, yeah, no, shouldn't have done that. So learn who is running, learn who shares your values, and make sure you vote in the primaries is what I would advise. And do local because everything starts at the ground up.
Okay, let's give her a hand.
Thank you.
That was awesome. We are a nonpartisan organization. That's okay. No, we welcome Susan and no, have a seat. You can have a seat. No, it's okay. And that's what we're all about. It's about educating. And you did a great job because at the end of the day, it doesn't matter what party you belong to. We all want accessible, affordable healthcare. All right. Okay. So let's give her another round of applause. She did an awesome job today. Thank you. We'll be in touch. Because health is such a big issue in Lee County, we have two directors. So I co-chair with Dana Clark. Is Dana on? Yeah, so Dana, my co-chair for health, she's gonna do the other part of our program today. So let's welcome Dana on the screen. She's coming live. Can you hear us, Dana? And then we have our two panelists that's gonna come up. You guys can come on up. The next two. We have Maureen. I'm gonna read the little bios. Come on up. Let's see. Get back. Okay. You can sit anywhere. Yes. To unmute. Dana, can you unmute?
I am. Would you like them to go first? So
Okay, I'm gonna read the bios and then I'm gonna roll it over to you. How about that?
that's fine.
Okay. Or you want to do the bio?
No, go ahead. I don't have
Okay.
the bios.
Okay. All right. So our panelist today is Rita DiSalvo, who's lived in Lee County for 36 years and has done volunteer work here for over 10 years. Her background is insurance and marketing. She's currently retired. Rita is the hub contact for the Florida Decides Healthcare. Early 2025, she started a local group called Southwest Florida Individuals .20. And this is how she is listed on the Florida Decides Healthcare website under hubs. She will have her contact information so you can feel free to reach out to her with any questions you may have. She is available to assist you with presentations, support, and any supply for Medicaid petitions. We are strongly focused on achieving success now and want to focus on it. So she needs your help. The next is Maureen Chase. Maureen, she is a partnership manager, Health and Wellness Coalition. She is, did I say your name correct, Chase? Okay, because it says Gleason on here. Is a partnering, she's part of the Collaboratory, a community foundation serving Southwest Florida. She's seasoned professional in robust background in project management, business leadership, and public health. She holds an MBA and a Bachelor of Science in Public Health from the University of South Carolina, and she's a certified health education specialist, bringing comprehensive understanding of health promotion strategies, systems, changes, and their practical application. In her entrepreneurial endeavors, she has owned a decorative concrete franchise, which she's not only achieved business growth and cultivated a loyal customer base, but also pioneered innovative solutions in employee recruitment. Notably, she has developed a curriculum for the Department of Defense Skill Bridge Program, assisting service members in acquiring new skills during their transition into the civilian workforce. She has over a decade of experience in nonprofit organization. In her previous role as Director of Programs and Evaluation, she has led initiatives focused on dementia care and brain health prevention. She developed and implemented innovative brain healthcare programs and has formed valuable partnership to help assist Hilton Head Island in South Carolina. She's a recognized Blue Zone promoting a healthier environment for residents and visitors alike. She's a hands a blend on experience, academic knowledge, and a deep passion for community well-being through some systemic change, uniquely positioned her to be a driving, impactful initiative person that drives tangible results in her communities. Let's welcome these two beautiful women to our panel today. Take over, Dana.
All right, can we have the first speaker?
Hi, everybody. How are you doing today? I was going to talk to you all about something else, but we've had a lot of changes this past week. So my group that is SWFL Indivisible. It's the Lee County chapter of a national organization. If you go to Florida Decides Healthcare, FDH, you'll see that I'm the hub for Lee County. I was going to come with petitions today and talk to you about helping getting them signed, but we've had some changes. This year, politicians in Tallahassee set out to make the citizen-led amendment process nearly impossible. Florida House Bill 1205, the ballot amendment bill passed by the Florida legislature and signed by the governor, was designed to kill the process by changing the rules midstream. Politicians in Tallahassee worked overtime to make it extremely difficult for citizens to put issues they care about, like Medicaid expansion, on the ballot. House Bill 1205 was designed to silence Floridians' voices by saddling grassroots campaigns like FDH with unconstitutional roadblocks that have impeded the progress in the necessary timeline. This law created unprecedented restrictions, from threatening circulator RICO charges to imposing heavy fines for simple paperwork mistakes to imposing unprecedented fees. These provisions are not about transparency. They are about intimidation, surveillance, and silencing Floridians. Florida Decides Healthcare, FDH, stepped up to fight back. Our legal strategy has kept the door to the ballot open. But the truth is, the battle in court consumed much of 2025. While we build a big coalition of grassroots organizations and poured heavily into our on-the-ground efforts, we were forced to devote our energy and resources to protecting the very right of Floridians to petition their government in the first place. Because of these deliberate barriers, we are now shifting our focus to gathering the 900,000 plus signatures needed to win 2028. While this law has delayed our efforts, it will not stop them. We remain committed to protecting Floridians' constitutional right to direct democracy and to ensuring every Floridian has the chance to vote on expanding access to health care. And with our initial wins in court and our upcoming trial, we are now in a strong position to ensure that we can make the 2028 ballot. This was always going to be a long, hard-fought fight. We have a clear 3-year plan to build on our legal wins in court, organize an even broader and stronger coalition, raise the resources needed, and organize at the scale necessary to overcome the barriers Tallahassee politicians created. Meanwhile, the stakes for Florida families have only grown. With cuts to Medicaid and the expiration of ACA, that's the Affordable Care Act, subsidies looming, more than 3 million Floridians, 1 in 5 of us, will be left uninsured and without Medicaid expansion. That will devastate families, shutter hospitals, create huge job losses, limiting patient options, and drive healthcare costs even higher for everyone. The good news is Floridians want change. Our polling shows that support for Medicaid expansion remains strong, over 67% with voters from all walks of life and across the political spectrum. That makes us as confident of victory in 28 as we would have been in 26. This fight has never been about healthcare. It's about defending Floridians' constitutional right to direct democracy. And the courts behind us, and with the courts behind us and a 3-year path forward, we are ready to finish the job. We will be expanding the coalition partners in every county, building our legal wins in court during our January 26th trial, gathering the necessary petitions with grassroots and volunteer-led energy, continuing to challenge laws like HB 1205 that threaten Floridians' constitutional right to direct democracy, building the resources needed to fund a statewide campaign to victory in 2028.
Hey, good morning, everyone. I am Maureen Chase, Partnership Manager here for the Health and Wellness Coalition. I know my last name is confusing, recently changed it because I was married about a year ago. So sorry about that. I do have some slides to share just for you all to look at, but basically here at Collaboratory, we have 3 different coalitions. We have our Health and Wellness Coalition, our Future Makers Coalition, and our Home Coalition. Can I get a show of hands if anyone in this room is a part of any of our 3 coalitions? Okay, I've got 2 and they're both a part of the Health and Wellness Coalition. So thank you for coming here today to support. Go to the next slide, please. So our big goal in the Health and Wellness Coalition is to transform Southwest Florida to be among one of the healthiest communities in the nation by exceeding the 90th percentile. Well, from the 2 lovely ladies who spoke before me, we know that we have quite a few issues that we have to address. Slide. So what we are as a coalition, we are not a organization, we're a network of cross-sector partners. So we're coming together with health professionals, nurses, doctors, nonprofits, government, to all have these conversations and to work on something together, because we know that no single organization can solve the deep-rooted problems that we face in our community. So we are looking at it as a system level approach. We're trying to understand the root cause of all of these challenges and work through pilot projects to see what might work and how can we change the relationships within the system to make a bigger impact for it. So here are some common questions that we receive. What is the coalition and what sets us apart? And I mentioned that we're working together on initiatives. As I mentioned, there are no single organization. There is no one entity that can solve all of our problems. For instance, you think of education, you think of our Future Makers Coalition, when you think of kindergarten readiness, that we know that less than 30% of kids are kindergarten ready to be able to be into kindergarten. We know that that is not just the sole responsibility of our teachers or just the sole responsibility of our parents. So how can we work together to make a difference so that we can increase the rate of kindergarten readiness in our. So in health and wellness, we have 4 focus areas, and these are our 4 regional action teams. We have active living, behavioral health, as somebody mentioned before me, mental health and behavioral health issues and substance abuse are some of the major concerns in our counties. We have our health systems and food access and nutrition. And here is just a view of what our structure looks like. So we are a coalition where we're not top down. Collaboratory is at the bottom as that backbone support. So we're really helping to guide the system, helping to move things to action. It's fine. Helping to move things to action. So we're the backbone. As normal organizations, you might have your executive director at the top and everything under. you see that we're the backbone support at the bottom. So we're working across the entire system. We're working with partners to help coordinate the work. Because just imagine you are the project manager for a construction company, and there are so many moving parts within that system to make things stay on track and keep things going. Imagine if that project manager is no longer there. That project is going to have some challenges. It's not going to be able to stay organized. It's not going to be able to work across sectors, and keep things moving to action. So within these regional action teams, we have various projects that we have to just test the system, to probe at the system, to see if we can do something together that might be working, that we've never tried before. So one of the projects that I'll talk about today is actually with Andrea in the room. We'll talk about Produce RX. So Produce RX project, this is a project out in Immokalee where community members, American Heart Association, Harry Chapin, Healthcare Network, Core Health Partners, they came together and said, we've got a problem. We're seeing that our community has a diabetes and obesity problem. And we're seeing this with the children, and we're seeing this with the parents. And what can we do together that we can't do in our own single organizations to help work through this challenge? So this project came about where American Heart Association had presented it and said, this is what we're doing. Food is medicine. Food is so important. We need to educate children. We need to educate families about the nutrition and education behind what they're putting in their bodies, and be able to reduce some of the challenges that they're having with diabetes or with obesity. So it was a full family approach where doctors and registered dietitians were working together to meet with the patient, to educate them about the nutrition that they would need in order to be healthier. They saw such great results in reduction of BMI, in weight loss, and just behavioral changes that will last throughout the entire family. So that's just one example of how you can have a bigger impact when you're bringing together multiple entities versus one single organization, because we know no one person or no one organization can solve diabetes or can solve obesity. So our theory is that how do we come together? How do we track in impact and outcomes, and then remove barriers for those who face the greatest need? Next slide. So here's just what we're looking at as far as outcomes and metrics for active living, and you can go through these and share these out to the group. So those are our metrics that we're looking for active living. We have behavioral health next. Behavioral health metrics. We're trying to ensure that services are readily available for individuals. As we mentioned, we have a shortage for physicians. We also have a shortage for mental health providers in our area. So what can we do together to reduce these burdens on the system? Food access and nutrition. We have a high rate of food insecurity in the area. In certain areas, in certain counties, are greater than others. So we're working across all county lines, and we serve all five counties within our region. So we're working and figuring out what might work in one area, and how do we replicate that in health systems. As Susan had mentioned, primary care physicians. We are at a shortage of primary care physicians. So what can we do to lessen the burden on the current system? How do we get down to the root cause? And one thing that was mentioned earlier is housing and affordable housing for individuals working in this space. No one can afford, not many people working at the rates that are in the market right now can afford a $900,000 house. And, put on top of that student loans and different expenses that we have. So what can we do together to try to make a difference? And as far as our upcoming events, so on that structure, you saw those four regional action teams. Every quarter, we meet our regional action teams. This is when new people come to learn about what we're doing in the coalition, talk about the issues they're seeing, and say, hey, I've got something that I see as an issue. Does anyone else see that? And we say, is there energy around that? Do we want to work together on something? It is not me as our partnership manager saying, hey, here's the issue. Let's do this. Let's work on this. It's partners coming together saying, I work in the field. I understand what we're seeing on the ground and how can we help and convene and bring partners together to solve some of those challenges. So this next slide will be our upcoming regional action teams, and those are in November. So those are either here at Collaboratory in this beautiful space, or they are on Zoom. So I would encourage you, if you're passionate about any of these areas, to join me to help work on some solutions and look at root cause to make our better place to live and work. Questions? That is just a slide on how you could join the coalition. If you want to learn more information, or if you want to sit down for a one-on-one conversation, feel free to scan that QR code. Happy to meet with you over coffee, in our lobby, or on Zoom.
Okay, thank you both, ladies. At this point in time, Dana, can you hear me?
Yes, I can.
Okay.
I can hear you.
Okay. All right. So we're gonna go into a question and answer session. You can you can stay here. Okay. Any questions from the audience? Dana, go ahead.
I can't see the questions from the audience.
Okay. All right. Do you? Oh, you don't see anything in the chat box, right?
No. Let me see. Let me click.
Oh, she has a short presentation. Ah, Dana, you have a short presentation. Go ahead.
Sure.
You're
But are there
next.
people?
Tag.
But
Go
are there
ahead.
people? Are there people in the chat box?
Don't worry about it. Say go ahead. We'll get the chat box later.
Okay. Can you see? Can you hear me?
Yes, we can. And see you
Okay.
loud and clear.
Okay, you can, because I can't see me. So, okay.
We can see you live in living color.
Well, I have to give you, all of you, credit. We agree wholeheartedly. I am a nurse and a healthcare provider and an educator and a member of the League, and my role is reproductive rights director. However, I agree with the shortage of everyone, because I too have been a nurse educator for many, many years. And one thing we're continuing to do is educate and advocate for a cost-effective application and approach to prevention and focus on health outcomes. So we are currently working with the expansion of access to dental care. And this is an example of how the dental problem can be helped by dental therapists. A new concept, which was on the legislative task last administration, was the dental therapists, who are mid-level oral healthcare professionals who work under the care and guidance of Florida licensed dentists to provide basic care that many Floridians cannot get today. Examples of the care include exams, simple fillings and extractions. Dental therapists graduate from the American Dental Association CODA accreditation and program, and they complete the competencies exams to do the procedures that they are performing. This has come with some trepidation from the Dentists Association, similar to what nurses faced several years ago with being nurse practitioners and PAs with physician's assistants. But we are going to be working with those in the Dental Education Association to facilitate more of these therapists into the healthcare providers in order to provide dental care for those people who currently are not getting it. We are very, very involved in Medicaid expansion, but the buck stops with the voter. The voter puts their vote, their ballot, for the legislator, and the legislators are impaired at some point because of those pharmaceutical companies and people who are behind the other side. So we, as the voter, have to look at and educate ourselves. We in the league have to educate the voter. And it has not been in vain. We are going to continue to work with them and also on reproductive rights, the right to choose what kind of provision of care we want. So we're watching very closely the changes in the vaccine mandates. While some vaccines are currently in Florida considered laws and they're mandated, others are rules. So we are working closely with the legislators to keep current laws, the DPT, the MMR, polio vaccines, which are mandated, while gathering support from those who are against rules change. We're promoting oral and behavioral health services and education. We're supporting accessibility of care and rights to be private, personal reproductive health care decisions. And we're supporting gun safety and gun and violence prevention. October is the Domestic Violence Awareness Month. We need to be vigilant. There's not a day that goes by that there is not a violent episode. We have to stand together as League of Women Voters members and help to educate the community. Partnering with Congress, strategically important. Although we may perceive them as the enemy, they are not. They are the people that can open the doors to democratic livelihood in this country. So we need to encourage them to renew the tax subsidies currently keeping healthcare down, costs down. We need to educate and advocate for those 2.1 million of the 4.7 million people in Florida who do get the benefit of these cost-containing measures. We in the League would like to partner with those of you who are out there trying to grow coalitions. It's very important that the people who vote become educated and become aware of both sides of a voting measure. And we need to make sure that regardless of your choice or selection of party, that democracy is the most important thing in the world today. And it's been a long, long time since we've even had to look at that particular element of what is being a democratic proposition. So we are asking to help, for you to help us, and we are attending to join coalitions which share the same values as the League of Women Voters members. And we thank you very much. The presentations were on target and they were very helpful to the average person who's watching and listening. And we thank you for your for the opportunity to hear what the population of Lee County and South Florida should believe. Thank you.
Thanks, Dana. Let's give her. Okay, so let's thank all our presenters today. And thank each and every one for coming out or being live on Zoom. At this time, we're going to turn over our program to our president, Sandy Frank, and she's going to continue on.
Thank you, Lorna. And thank you, speakers and panelists, and thank you for the good questions today. I think everyone has been engaged. Healthcare is an issue that affects all of us, and we have some ideas now of what we can do, continue to do, and certainly an issue that's critically important for Lee County. Healthcare is one of the issues that the League works on, and we're a little short on time. We try to stay on time, so I'm not going to go through all of our other issues, but I would like to remind us that we all know this. We are an all volunteer organization. And so everyone here who's on the board and who's a member, they are volunteering their time to bring these programs together and to advocate in Lee County. And one of the things we'd like to do is to share a little bit of information from two of our board members who are quite enthusiastic and volunteered, in addition to all their other duties, to give a little promo. So I'm going to turn this over to Eddie and Jacqueline.
So I'm going to go over a little testimonial with you. And I did write it down because if you know me, I tend to go on and on and on. So I had to write it down to kind of stick to my script. And first of all, I want to apologize for all the technical issues we had in the beginning. We hadn't been in this building for a few months, so it's been a while since I've had to interact with this equipment and play nice with it. But anyway, so my love for the League of Women Voters of the Lee County runs deep. As the secretary and membership chair of the League of Women Voters of Lee County, I'm honored to share my deep admiration and love for this remarkable organization. The League's unwavering commitment to empowering voters, educating our community, and advocating for fair and accessible elections is both inspiring and essential to the health of our democracy. What makes the League truly special in its steadfast dedication to nonpartisan civic engagement, ensuring that every voice is heard and every vote counts. I'm continually inspired by the passion, integrity, and collaboration of our members, whose efforts help build a stronger, more informed, and more inclusive Lee County. It's a privilege to be a part of this work and to serve alongside such an extraordinary group of individuals who believe in the power of participation and the promise of democracy. Together, we're making a meaningful difference, and that's something worth celebrating. Our community thrives because of the time, energy, and talents of people like you. Volunteering is one of the most meaningful ways to make a difference. Whether it's handing or lending at an event, sharing your skills behind the scenes, or helping us reach each other in need. Every effort, big or small, strengthens our mission and brings us closer together. If you've ever thought about getting involved, now's the perfect time. Join us, step up, and be a part of the impact that we can truly achieve together. And in saying that, we do have a volunteer interest checklist that while you're here, if you're a member, please take this and fill it out. We do desperately need volunteers. And the people that we work with are absolutely wonderful. I think I pretty much said it in there. We're just a spectacular team. So if you're a member, please pick up one of these and return it to me or Jacqueline, or actually any of us that's on the board. If you're not a member, you can become one today. It's a very minimal donation that you can give to us, but just kind of think about that. And again, if you remember, grab one of these from me and we'll get you on a volunteer committee.
Everything that he said. I'm going to be real short because I kind of fly by the seat of my pants. That's usually the way I kind of do things. But one of our missions here is to bring people together, you know, whether we have differences politically, but out of that, all of that, we can find at least one thing that we can agree on. And that one thing we can work together to accomplish, especially with healthcare. I have a 90-year-old mom. She just had a birthday in September the 19th. And I'm one of those. My mom is one of those. And as we get older, we become one of those people, as well as pediatrics and everything else. So within that, no matter what our political ideology may be, we all need healthcare, and that needs to be addressed. That's one of those things that I think every one of us can agree on, that we need the healthcare coverage and everything. That's one of the reasons why I love the League of Women Voters. I've been involved with a lot of organizations. I still am involved with a lot of organizations, but this is the one organization that I think is set apart because we take action. And that's one of the things I love about it. But mainly, you know, join us. We're seeking people who want to be a part of the community, young people that really want to be a part of the community and be our leaders, because I'm going to need y'all when I get about 75 years old, you know. So, but join us. We're here. We want you to be involved, but we want to make sure that when you are involved, you're doing something that you enjoy. So please keep in mind the paperwork that Eddie has shared with you, completed. If there's anyone good with numbers, I'm good with numbers as long as I have my fingers, unless it's trig or something, trigonometry or something like that. But let us know, and we want to ensure that you're enjoying your time with us, with the league, but also making a difference in the community as well. We want to see you back. We hopefully you'll tell your friends and your family, drag them along and let them know that we are making a difference and you are now making a difference with us. Thank you guys so much for coming, and we really appreciate you being here. And I'll turn it back over to our president, our esteemed president.
Thank you, Jacqueline and Eddie. And you can see, you've just seen part of our team. We have a really great team and we have a lot of things that we're working on. Just briefly, I want to remind us a couple things we have coming up. We have our November program is called Embracing Differences, A Path to Stronger Communities. That will be back here on November 1st, 9 to 11. And the December program, again, here will December 6th, Florida's public schools and charter private options. Now, before you all leave, we do have another program starting at 11:15. Nancy Leverance, our event coordinator and also youth coordinator, and what else do you do? Anyway, she has prepared food for us. She's always our go-to person for our food. So those of you who are staying for 11:15 on mid-cycle redistricting, you will be able to get a snack in between now and 11:15. Those of you who are not able to stay on the table, on the registration table, there is a blue sheet out there now that says say no to mid-decade redistricting. You can pick this up. And we have some resources available, the QR codes that are on your agenda. The top one is to the League of Women Voters Lee County website. You can join through that. You can add yourself to our email list. You can see our issues that we're working on. And the QR code that is next to the mid-cycle, that is a lot of resources on redistricting that you will be able to access when you reach out to your legislators to tell them your opinions on mid-cycle redistricting. So we are going to have a program on that at 11:15, and Betsy, thank you. We'll be conducting that, and I see a hand in the back. Sorry. Go ahead. I can't hear you, sir.
Time that you have with your doctor is shortened to what, 8 to 9 minutes that you commented on? 8 to 12 minutes. My background is healthcare. I actually used to work for Johnson & Johnson Pharmaceutical Company. I'm retired since 2021, but I called on rheumatologists and gastroenterologists in the New Jersey area. And I just wanted to just make a comment and say that as patients, I understand that our physicians only give us 8 to 12 minutes, and that is because less than 46% of those physicians do not practice in private practice. They are practicing in a healthcare system. So they are employees of the healthcare system. So that's why they have certain times. However, as a patient, manage your own appointment. Don't let the physician manage your appointment. So go into your appointment prepared with questions to ask your physician. So if they're trying to rush your appointment, don't allow them to. But if they continue to do that, look for another physician because they don't care about you. All right, that was my comment.
Thank you. Okay, so we really don't have time for questions. We can have some informal networking after this, and you're not going to let me get away with it.
So far, what I've heard is the physicians control. I want to defend that because the physicians do not control. The control is
true.
in the hands of the people who collect the finance. They
Mm.
direct what the physicians do. That is your priority. We need to get to the head. The physician is not that. Okay? So when you look at where you're going for your appointment, that's not where you start. Okay? That the hospital even has the same type of problem. They go somewhere else with something between you and that hospital. All right, so United Healthcare, for instance, is an example, and there was an attack upon United Healthcare. I'll just bring that up.
Thank you. I am going to close with these final words. Make sure you're registered to vote. Renew your vote by mail information. It has to be renewed every election cycle. Also check your voter registration information because there might have been some changes, especially for those of you who have recently renewed your driver's licenses. Be informed and make your voice heard. Thank you very much for coming and stay until 11:15, please, at 11:15.